Okay, let's dive right into this. In today's explainer, we are unpacking something really fascinating, a conceptual platform for AI-assisted preclinical drug discovery authored by independent researcher Lázaro López Paz. And we are staying totally faithful to the original project documents here. We're talking a meticulously documented blueprint, complete with all the hard mathematical formulas, the thermodynamics, the logarithms, and the hyper-realistic visual models that try to map out the exact future of therapeutic peptides.
So here is our roadmap for the explainer. Think of this whole thing as a sort of methodological funnel. We're going to start broad with the assisted peptide platform, dive into the actual equations and computational design, look at the priority programs, explore some advanced technologies, and then finish up at the narrow end of the funnel with preclinical validation, budgets, and the strict decision criteria. Let's get to it.
Section 1. The Assisted Peptide Platform. Right off the bat, we need to establish that we are looking at a rigorously structured preclinical model. This is absolutely not some ready-to-market biohack or a validated clinical treatment, okay? It is strictly a controlled environment for testing hypotheses.
And the way it operates is through this continuous feedback loop made up of 6 fundamental steps. You start with a defined hypothesis, right? Then you move through AI-assisted computational design and prioritization. From there, and this is absolutely crucial, it has to face independent external validation. That leads to a formal review and a very hard decision point. Do we advance, redesign, or ruthlessly discard the whole concept?
And this brilliantly illustrates the actual flowchart straight from the dossier. Just look at the visual simplicity of this scientific cycle. Design, measure, learn, decide. It is specifically engineered to prevent researchers from, falling in love with a failing idea. Every single step is an intentional checkpoint to keep things totally objective.
But you might be wondering, who is actually driving the car here? Well, the dossier makes a really strict division of labor. Artificial intelligence does all the heavy computational lifting. We're talking structuring massive data sets, organizing bibliographies, and supporting the conceptual design. But the human author, they hold all the ethical responsibility, the final data interpretation, and the regulatory compliance. In short, the AI proposes, but the human disposes.
Moving on to Section 2, Equations and Computational Design. We are not just talking about abstract ideas here. We're going to look at the exact chemical equations and thermodynamic formulas that govern how this AI platform actually prioritizes these peptides. Okay, here is the actual math. The priority score literally balances the positive traits like binding, stability, and solubility against heavy penalties for things like aggregation and clinical risk. See those W variables? Those are weights that must be locked in by the human before even looking at the data, completely neutralizing any AI bias. And check out that thermodynamic reference equation below, where the standard free energy of binding relates to the natural logarithm of the dissociation constant. Beautiful, right? But remember, this model's potential, it doesn't guarantee clinical safety in a living, breathing organism.
Now, what's really interesting about this slide is how these super realistic, rapid-fire images map out the kinetic foundations of these smart peptides. They rely heavily on thermal relaxation equations and transition energies. It's a perfect example of how the platform uses these incredibly detailed visual maps to guide early conceptualization, merging molecular kinetics with optical control parameters.
And before a peptide even gets near a petri dish, it has to pass a conformational energy model. This specific formula calculates total energy by summing up the bonds, angles, torsions, van der Waals forces, electrostatics, and solvation. Basically, it helps the system detect structural tensions digitally. That saves an immense amount of time and money before ever moving to a real lab.
Section 3. Priority Programs. Moving further down our methodological funnel, let's focus on the 2 biological targets that have the highest preclinical viability, Imusynth and Myoflex.
First up is Imusynth. The goal here is localized immunomodulation in highly specific acidic niches. Conceptually, it works like this. The peptide stays compactly folded at a normal physiological pH, but the moment it enters an acidic, diseased environment, it's designed to open up and interact with immune cells. It acts almost like a lock and key that's completely governed by ambient acidity. Again, this is a conceptual illustration, not a lab result yet, but the mechanism is fascinating.
The second priority program is Myoflex, which looks at cyclopeptides targeting pathways related to severe muscle loss, think sarcopenia or cachexia. And we have to firmly note the ethical disclaimer built directly into the protocol here. This research is exclusively for debilitating muscle conditions. It's engineered entirely around disease pathology, meaning absolutely zero application for physical enhancement or doping in healthy people.
Section 4. Advanced and Exploratory Technologies. We have 4 remaining programs in the portfolio, and these are kept around specifically for early de-risking or because they represent high uncertainty exploratory lines that push the boundaries of current science.
Let's move to and see how this builds with neuroplastin. This one focuses on synaptic interactions within the synaptic cleft for models of neurological disease. And just like MyoFlex, the framework strictly confines this to disease modeling. It explicitly maps out pathways for pathological repair, expressly excluding any claims of cognitive enhancement. The goal is to see if molecular interfaces can actually be stabilizing during neurodegeneration. Next is MitoGuard. Now, the absolute hardest part of this specific program is separating true specific modulation of mitochondrial dysfunction from just general, highly dangerous cell toxicity. The core concept here revolves around preserving mitochondrial cristae against fragmentation, which, if you know the field, is a massive hurdle in early-stage metabolic drug discovery. Then we have Senolytic X, which targets senescent or zombie cells. But the author puts a really strict limitation on this. This program is entirely restricted to defined pathological contexts where that senescent burden can be explicitly and empirically measured. So to be clear, it is not some general anti-aging or longevity intervention. It's a targeted response to measurable cellular stress. Finally, we reach the most complex exploratory line of them all, cardioregen. This targets the Hippo/YAP pathway, right at the border zone between a collagen scar and viable heart muscle. Because the risks of cellular proliferation in the heart are just massive, this remains a strictly low-priority exploratory line that is heavily monitored for early failure indicators.
So the crucial point is exactly how they mathematically measure that risk. Look at this equation. The net utility of cardioregen equals the benefits of tissue repair, strictly minus the severe, mathematically weighted risks of uncontrolled proliferation, deadly arrhythmias, and off-target effects. If that equation doesn't balance favorably right from the very start, the project simply dies on the whiteboard.
Section 5. Preclinical Validation and Budget. We are at the narrowest part of our funnel now. Because, let's be real, great formulas mean absolutely nothing without independent real-world validation and a realistic budget to actually execute them.
Here's the actual order of magnitude budget for a single Round 1 priority program in Europe as of 2026. One really standout addition from the project's version 1.2 addendum is that FTO line item right there, the Freedom to Operate search. They allocate 1 to 4,000 euros just to ensure no existing patents are infringed before a single molecule is synthesized. That brings the total realistic cost to validate just one program to somewhere between 32,000 and 109,000 euros.
Which brings us to our final section, strict decision criteria. When you're managing those kinds of budgets, you need ironclad rules to prevent projects from turning into endless, resource-straining zombie research.
Before a single dollar gets spent on synthesis, the researcher and the independent lab have to agree on these criteria. You can advance, you can redesign, or you hit a no-go. And I love this part. The framework introduces a strict time threshold. If a program gets stuck in redesign and fails to advance after 2 iteration cycles, which is about 6 months, it automatically becomes a no-go. The human reviewer ruthlessly discards it to save precious research resources.
We'll wrap up with this vital quote straight from the source. The hyper-realistic imagery, the complex mathematical models, the thermodynamic blueprints, these are all tools for structuring thought, not proof of clinical success. It leaves us with a pretty provocative question. By embracing this brutally strict, mathematically grounded framework right from the drawing board, could we prevent billions from being wasted in early-stage biotech and actually get real therapies to the people who need them faster? Thanks for joining me on this explainer. See you next time.